it's the time. Let us start. Thank you very much, everybody, for joining this webinar. This is actually the repeat of the webinar which we held first time on 21st of April. Now, what we are going to do in this session is that we will define what is CBL and how what is its structure and how it is conducted. So these are our three learning outcomes for this session. And when we are describing how to conduct, we will be going through three different methods: normal to abnormal approach, modified essay question, and case presentation. So first, introduction to CBL. Basically, it is a problem-solving exercise, and students would learn through the process while they are solving the problem. And application of previously acquired knowledge. So this means that the case should be related to the previously acquired knowledge. We should know first what students have been taught previously, and we should select a case which requires the application of the previously acquired knowledge. And the advantage of this is that this is a common complaint among academicians in medical schools, that students don't know how to apply the knowledge. They know, but they know the knowledge, they know the information, but they do not know how to apply in a particular situation. And case-based learning addresses that very effectively. Learning through peers, interaction, and lecturers' input. So in CBL, there is learning between the peers and the lecturers. So that is another a different aspect from PBL, where the lecturers have a limited role in teaching, whereas in CBL, the lecturers have an important role in teaching. It promotes deep learning and develops clinical reasoning skills among the students. It is an inquiry-based learning where students are required to ask a lot of questions, then analyze the information, and then apply that analysis to the problem under hand. And it links theory to the practice. So again, the question of application of knowledge, that whatever students have learned theoretically, they would learn how to apply it in practical situations. Because most of the participants are familiar with PBL, so it is easier to describe or compare the PBL with the CBL, so that it's easier to understand. And the difference would help us to really learn the concept of case-based learning. In PBL, the learning is while students are trying to understand the problem. And that's why they learn about the basic sciences, anatomy, physiology, etc. Whereas in CBL, the learning is while solving the problem, means to solve the problem, you have to apply your previously acquired knowledge. In PBL, typically the information is given over time, whereas in CBL, information may be given over time or may be given at once in one setting. PBL is truly integrative. PBL is based on integration, where CBL is mainly a discipline-based. So this is again a big difference between PBL and CBL. That PBL is mainly a discipline-based, and there is a very minimum integration. In PBL, the facilitator does not teach, whereas in CBL, the lecturers or facilitators, they have a significant role in teaching. While in students' role, in CBL, students are responsible for applying their previous knowledge, and each student contributes in the group to solve the problem under consideration. In resources, in PBL, we give only the core resources, whereas in CBL, the complete list or whole material is provided. So, like in PBL, the students have more liberty of selecting the material they want to read, but in CBL, they are provided and they more or less stick to that material which has been provided. Coming to the structure of the PBL, it can be different in preclinical years as compared to clinical years. In preclinical years, there are 2 sessions within a week. The CBL1 or the first session usually takes place in the beginning of the week and where the whole class is involved. And it can be in form of a lecture, or it can be in form of directed self-learning where a material is provided to the students and they learn themselves. But important is that this is a session for the whole class. Whereas in the second session, the students are divided into small groups like in PBL, 8 to 10 students in a group, and they use dedicated small rooms, and we can use the same rooms as we use for our problem-based learning sessions. And this is towards the end of the week. During the second session, basically, if we have discussed any case in the first session, the second session would give a different or variation of that case. Or if we have discussed theory in the first session, the second session may give a scenario where the previously acquired knowledge is applied. In both sessions, CBL1 and CBL2, the identified learning outcomes for that week are covered. The first session of CBL, for example, if it is a lecture, that would be a normal duration of a lecture, but the CBL2 or second session may last 2 to 3 hours. The session of small group follows more or less same what we do in problem-based learning. Students work together as a group. The group attempts to solve problem using critical thinking. The discussion is student-centered, and the discussion allows the students to integrate knowledge gained. It is within that discipline, in just relation to that case. And the tutor helps facilitate group discussion by asking provocative questions. And the tutor helps correcting the incorrect statements. Again, this is now a big difference between PBL and CBL, where the facilitator plays a role if some student is making an incorrect statement. The facilitator would correct that. The tutor does not give a lecture, does not dominate the discussion, or does not become the focus of discussion. Now, going to the third part, how to conduct a CBL session. As I mentioned, there are 3 methods we are talking about today. Normal to abnormal approach, which is mainly applicable to preclinical years. Modified essay question or interrupted method or CPC method, which can be applied to both preclinical and clinical years. And then case presentation, which is mainly applied in the clinical years. First, let's talk about normal to abnormal approach. Now, these are the learning outcomes for the case we are using as an example. By the end of this session, which is the second session of CDL, the students will be able to discuss the changes in the hemodynamics of cardiac cycle in acyanotic type of congenital cardiac anomalies, and explain the pathogenesis of reversal of shunt or Eisenmenger syndrome in ventricular septal defect. Now, these are two learning outcomes which we want to achieve. And now, how to achieve these learning outcomes? The first session would be on the cardiac cycle in a normal heart, which I think most of our physiologists would teach in a cardiovascular module, usual lecture. Nothing special in that. But based on that, when we have a second session, that is CBL2, then we will introduce very briefly what the anatomical defect, for example, of VSD or PDA or TGA. And then we ask the students to apply their previous knowledge of a cardiac cycle in a normal heart in an abnormal situation where there is a ventricular septal defect. And then students have to think about the pressure changes, about the mixing of oxygenated, deoxygenated blood, what could be the oxygen saturation, what could be the pressure changes, and what could be the complication. So in this example, clearly we see that students, if they understand what is a normal cycle, they would be able to think that what would happen to hemodynamics if there is a VSD or PDA or TGA. And so learning issues are addressed in the same session. Again, practically there is no homework in CBL. All the learning issues or questions which arise during the session are addressed there and then. Here is another example. Again, for example, regulation of thyroid functions is taught as a lecture. And then after that, in the second, the first session covers the normal thyroid hormone synthesis with feedback mechanism and functions of thyroxine. The second session, or CBL2, will be using the same diagram, but now we would be creating a scenario where the thyroxine is not being produced or thyroxine is being overproduced. So situation of hypothyroidism and situation of hyperthyroidism, and then students are expected to conclude from there based on the functions of thyroxine which have been taught previously, and the feedback mechanism, that what would happen practically in a patient, what could be the symptoms, what could be the signs, what could be the complications, and what could be the biochemical changes. Again, any questions or issues which arise during this session can be addressed there and then. The third example is from anatomy, where we can take an example of a compartment syndrome, and students are taught the compartments, for example, in limbs. And then a scenario is presented of a compartment syndrome, and then students have to think about and find out what would be happening to different structures in that compartment. And based on that, what could be the signs and what could be the symptoms. So this is learning about pathophysiology of a compartment syndrome by applying previously acquired anatomical knowledge about it. The process which takes place during this normal to abnormal approach. First is, in the first session, there is a lecture, or there is a directed self-learning, or there is an assignment. In the second session, the introduction to a case means variation of previously acquired case. And in this situation, we just discussed VSD. And then the questions to be answered, what would be the changes in hemodynamics? And that can lead to what kind of symptoms, signs, or complication. The students try to answer these questions as a group, and facilitator guides them, makes corrections, and answers some of the questions on the spot. So this is the first approach, which is normal to abnormal approach and mainly applicable to preclinical years. Modified assay question can be applied to both preclinical and clinical, and this is progressive unfolding of information, where information is given in bits and pieces, mainly in relation to the questions asked by the students, and then students would analyze that information and try to solve the problem. The same situation happens in CPCs, where progressive disclosure of information is given. For example, first history is given, and then the findings on physical examination are provided, results of investigation, a final diagnosis, etc. So it's a sequential way of looking at a case and solving the problem. Same thing happens in case presentation. In this situation, for example, 4 or 5 students can clerk examine a case, and then they can come to their in a classroom setting with the peers, and then we can have an exercise to solve that problem. For example, one student who has taken the history completely can become as a guardian of the patient, and rest of the students would take history from this student. So every student would be involved in this exercise, would be playing an active role and asking the relevant questions. And if the question is different or appears not really relevant, we can ask the student to explain the reason why they are asking the question. The second student who has all the information about the physical examination, they can provide very basic information, for example, anthropometry or vital signs, but students have to ask the question to find other information. Now, important here is that in first session, history taking, well, the whole class has taken the history from the presenting students. The whole class has to make a list of differential diagnosis. And then this list can be modified based on the examination findings. Some of the conditions can be deleted, or some of the conditions can be added. Now, the third student who has the investigation results, again, he or she would provide that information based on the request of the students, or based on the questions of the students. And here there would be the discussion on the pathogenesis of symptoms and signs. And then the last student can present the actual management, what was done in the hospital, and we can discuss the alternate methods of management. We can also discuss the latest information in the literature provided about that particular case. So this is the third method of conducting case-based learning, but because this is based on the real cases in the hospital, so it's more applicable to the clinical years rather than preclinical years. Right. So that's basically an introduction and the method. And here I can give you an example which I used recently for clinical students, a case of failure to thrive. And these were the learning outcomes, the definition of failure to thrive, causes of failure to thrive, and the history taking, physical examination, etc. But we started with a photograph. And by showing this photograph, we asked the students to identify the abnormal features visible in this photograph. And almost very clearly, students would say that there's a muscle wasting. Ribs are so prominent, there appears to be abdominal distension. The eyes appear very prominent because of loss of subcutaneous fat, and then you can see the muscle wasting in upper limbs as well, and maybe thinning of hair. So with all these findings, you can ask what is the most likely situation, and some students might come up with the diagnosis of marasmus or failure to thrive. Then we provide further information, giving the age and the date of birth and expected date of birth. And then we ask them to interpret the above information. And obviously they have to come to a conclusion that this is a preterm delivery. And what they learn here is how to calculate the corrected age in a preterm baby. Then further information was provided, the birth weight and the anthropometry. And again, they have to analyze this information using the percentile chart. So they learn how to use the percentile chart and how to interpret the findings on the percentile charts. And then the questions are asked to justify their answers and likely causes in this child, not general, not theoretical, but in this particular child, and what could be the impact of failure to thrive on growth and development of this child. The next question could be, one, what information needs to be gathered here? What are the physical findings we should be looking for? And what are the investigation to be done? And we provided some results and asked them to interpret, and the principles of management. So that is in short basically the concept of case-based learning, the how it should be conducted, and what are three different methods available to us which can be applied to preclinical and clinical students. So if there are any questions, I would be happy to answer that. You can unmute yourself before asking a question, or you can write a question in the chat box. Thank you.
Sir, Dr. Danish here. May I ask a question, please?
Yeah, sure, please.
So you said that CBL requires application of previously acquired knowledge.
Right.
That gives me an impression that before a CBL 1, there has to be a session of acquiring knowledge in some way, either a lecture or something else.
That's right.
Could you please explain the situation? Is the first session meant for acquiring that knowledge, or is it something before the first session that is used for acquiring the knowledge? Please explain.
You see, now the situation here is that students have to apply the previously acquired knowledge. So this means that they should have knowledge which has been acquired previously, which can be anything which has been taught previously. The one I did recently was very interesting and successful, that at the end of CVS module, when they have learned everything about CVS, we presented a case of, it was about the hypercyanotic spell, and the one was other Eisenmenger syndrome, where now they have to apply their previously acquired knowledge. So either it can be based on the previous lectures, or if you want to plan it to achieve certain learning outcomes, you can plan the session first in whether it's a lecture or SDL, so that students have that knowledge. And then in second session, you check whether they are able to apply it now. That's why we are saying it CBL1 and CBL2. CBL1 is just usual exercise, lecture or whatever, whereas CBL2, now what we can do is we can check further that the things which we wanted to the students to learn, whether they have really learned or not, we can check in our second session. I hope that answers your question.
Thank you, sir. Thank you very much.
Obviously, the students have to come prepared for this, and we need to encourage them that they, in this case, they would know that what is the topic going to be discussed. Topic means, let's say it would be a case related to, for example, CVS or respiratory system, but they wouldn't know the actual case which is going to be discussed. It would be only during that session they would know. The students should not know the case which you are going to discuss, but they would know the let's say the system you are going to discuss, but case would be revealed only at that spot.
Prof, just
yeah.
Prof, Dr. Imdad here.
Yes, Prof.
Yeah, so just a supplementary question to the previous question.
Right.
So the CBL1 is on a particular discipline, say that just a lecture on a physiology or maybe an anatomy.
Right.
But the CBL2 has got quite a 2 or more number of learning outcomes.
Right.
So which may not have been covered in CBL1.
No, if we take the example we were just mentioned of VSD, now students have been taught about the normal cardiac cycle, right? And when they come in the second session, they are told that no, it is not a normal heart, but there is a defect in the ventricular septum. And simply that information is given that there is this anatomical defect in the septum. And now you think and imagine what would happen to the circulation. And now, obviously, now if you know that the pressure on the left side is higher than the right side, there would be left to right shunt, there would be mixing, then there would be more blood going to the lungs. So they would be able to apply whatever they have learned previously. If we really want to take a big advantage of that it would be good to conduct towards the end of a module where students have covered multiple disciplines, and then you can give a problem which can see the application of different disciplines. That can be the one way. And but obviously before the CBL2, we should know what level or what has been taught to the students, what has been covered, so that we can choose the case which is relevant to what has students been taught or what they have learned at their own. Yeah,
Thank you, Prof. Thank you.
Yeah, answers your question.
Yes, Prof. Thank you so much, Prof. Thank you, Prof. Yes.
The one thing we need to clear that while starting the CBL2, we have to introduce the problem, right? Like in this case, we have to introduce the child with VSD, and if they have not been taught previously about the anatomy, we can simply introduce in very simple terms, maybe in layman terms, that there is a defect in the ventricular septum, and now you applying your knowledge about the normal hemodynamics, you see what would happen to the circulation in this particular child. And more than that would be that what symptoms and signs can appear before because of these changes in the hemodynamics.
Assalamu alaikum. Can I ask a question, please?
Yeah, sure.
Okay, I'm Dr. Nilofer. I'm a gynecologist and I have an interest in medical education as well. I just want to ask you that in CBL2, once we are asking for a problem to the students, does it have to be theoretical problem or a hospital-based live case? Or we can just make our own case according to the learning which they have already done in CBL1?
Yes, madam, if it is a clinical students, it has to be a real problem. That would be the most appropriate. For preclinical students, we may use the real problem, but we have to modify according to the level of the students, or we can create a scenario ourselves.
Okay, even in clinical cases, we can create our own scenarios?
Of course, we can create, but the ideal would be really, let's say, no, you can say whether we are talking about year 3, year 4, or year 5. In year 5, definitely real cases, so that they really know how to apply. In year 3, you might have some modification to suit the students, but if we can use the real cases, they would be the best.
Thank you very much. It was a very important lecture, and I have really enjoyed going through it.
Yeah. So another point is that in CBL2, we allow the students, if they need to see information, whatever source they have. For example, somebody might quickly use their handphone to look some information, or may use the textbook to get information. We don't stop them, because that is a learning process. It is not that we are examining the students. We are giving them a problem, and we are asking them to solve that problem and use all the resources to solve that problem. So in fact, it really helps when we ask them that they can use the resources. They would quickly look at the different resources and discuss. So the point is that it is a learning session. It is a teaching learning sessions, and we can use all the resources there. So there shouldn't be any restriction that student cannot look at the books.
Thank you very much. One another question.
Yeah.
That before we start the CBL2 session, can we tell them that the fla patient, so-and-so patient is lying on this bed in this ward, or we can give the summary of that real patient to them before the beginning of the CBL2? Because you said that they will be given the scenario once they will come for the CBL2. Is
Right.
there
Yeah.
any...
I don't think it would be necessary to give all that information about the location of the patient, because that's not important. Important would be what is the real problem. You can say this 50-year-old man presented with, is a known case of hypertension, and now presented with, for example, deterioration in conscious level. So I think that should be okay.
that can be given to them even before the beginning of the CBL2?
No, it should be introduced in the beginning of CBL, because we want them to solve that problem, which we present them at the spot using their previously acquired knowledge. if we give them earlier, then they might come up with, they might be able to read and come up about that. So, but that's not our point. Point is to see whether they can apply the information which has been given to them previously.
Thank you very much.
So any
Sir, I am Dr. Nawaz from Faisalabad.
yes, sir.
I want to ask a question that what does case means actually? Does this mean the signs and symptoms of the patients, or we would let the students know the diagnosis? Because if you present the signs and symptoms, then we do not know at this moment the diagnosis. Then
Okay.
how to teach them the basic, if there is a long list of differential diagnosis, say 10 to 15, then what about the basic knowledge of which diagnosis we would like to teach them?
Yeah, Prof, it depends what level of students you are dealing with. If we are dealing with the preclinical students, then generally we try to give a case for, again, I'm talking again and again about VSD. We are telling them that this is VSD. So we are giving them a diagnosis and then asking them that now tell us what would happen to hemodynamics in this child who has VSD. But when we come to clinical years, then we have to generally follow what we do is in case presentation, that we can give the presenting complaints and then ask them, okay, what further information you would ask, how would you take the history? And then once you have got that information, how you are going to analyze that information. And at the end of the history taking, the whole class may list down the provisional and the differential diagnosis. So then it follows, and this list may be modified along the way when we are having, let's say, physical finding or investigation results. So it all depends what level we are talking about and what is our main function. Let's say you want to see, for example, whether students can manage a case of, for example, hyperthyroidism. Then maybe you can start with scenario with giving maybe giving the diagnosis as well, that the patient was diagnosed to have hyperthyroidism, and then we ask them, okay, let's see how you manage this patient and what are different options available as to manage. So this means that they previously they know the different options and different ways of managing a situation and see whether they can apply that in this situation. So in a nutshell, there are 2 points to your answer. One is it depends upon the level of the students, and second is what are your learning outcomes. So you can modify the case and the situation accordingly.
Thank you, sir. Thank you for explaining.
Yeah. Any other questions?
Sir, may I ask a question? I am Dr. Danish.
Sure.
Sir, please, how would you compare and contrast CBL with TBL, which is a single session activity in which the CBL1 is replaced by a DSL, and CBL2 starts with ensuring that students possess the necessary knowledge to go through the application exercise?
All right. Yeah, actually that's what I presented earlier. I think it was the 3rd or 4th slide where we compared the PBL with the CBL. Now the first is.
Sir, I'm sorry, please.
Yeah.
I'm not talking about PBL. I'm talking of TBL, team-based learning.
All right.
In
Okay,
which the first the students are given the necessary knowledge as DSL, and then it starts with ensuring that they have acquired the necessary knowledge in the form of an IRAT exercise and a TRAT exercise.
Yeah. I understand. So how CBL is different than TBL, right? That's what the One is that,
Yes, sir.
yeah, the first session can be the same, because in both cases, in TBL or in CBL, we are actually assessing the whether students can solve a problem or not. So but the second session would be different, and that is where here is in TBL the whole class is being managed by one person, whereas in CBL we need multiple people, and the focus here is uh, very specific to application of previously acquired knowledge. And then here lecturer is helping the students along the way to come to a conclusion. So where the common thing about TBL and CBL would be that there is a peer-to-peer learning. So there are some some similarities in CBL and TBL, and there are some differences. Now, point here is that these are not mutually exclusive. We are not saying that all cases should be, all teaching should be case-based learning, or all teaching should be TBL or PBL. Point here is that if we have mixture of these teaching methods with each method emphasizing on a particular aspect, that with the hope that this mixture would help students to learn better. So that's the point. But definitely
you,
there
sir.
are similarities between PBL and CBL. Again, there are similarities between CBL and TBL. Some modification here and there, but it gives us sort of more tools to apply for effective learning.
Thank you, sir. Jazakallah.
Yeah, any other questions?
Sir, Assalamu alaikum. I am Dr. Nilofer from Peshawar, and I'm a dedicated medical educationist. And I just want to ask, what would be the ideal timings for a CBL? Like if we do at the end of the module, like we take a CVS as an example, then if we teach a topic that has already been taught, then it means that we are repeating that topic.
Yeah, in that case, madam, you don't have to teach it again.
Okay, CBL 1 will be bypassed.
Yeah, because you have already covered the module, and I think that is probably one of the best situation where CBL can be applied, because we have covered the module. It has already been taught. So let's say it's the last week of the module, and we want to see not only whether students have understood what has been taught, but whether they can apply that. That would be really a very, very good situation of conducting a CBL.
Okay, in that case, we will bypass CBL 1.
Right.
And in other situation, we can take the help of CBS for teaching those topics. Like every week we can have a CBL, and like that, we can do that easily.
Yes, if you are following the theme of the week, so you can have a CBL on that theme at the end of that week. So there are different, the options available, as long as the principal is there to give the students an opportunity to utilize the information whatever they have learned previously.
And so my second question would be, what would be ideally the gap between CBL 1 and CBL 2?
There's no really fixed rule for that, but just giving a couple of days in between may give students some time. For example, we have given a lecture or is a DSL, and some students would like to go back and revise that and learn that. So just give enough time so that they have actually learned and absorbed what has been taught before we see whether they can apply that.
Thank you very much, sir.
Yes, any other questions? If none, yes, please.
This is Dr. Wahid from Lahore, and
Right.
I'm a medical education student also, and I'm
Right.
practicing these principles in my college. So
Okay.
my question would be that it's not basically a question, but I would just like to comment or and deduce from this that you have said that CBL1 would always be the C1 or C2 learning, which is the cramming up of knowledge, which is the revision of knowledge, or which is the building up of knowledge, and CBL2 would always be the application part of it. So whenever we have done completed a lecture, and in near future or in later future, we think we want to give a knowledge of application of how to apply this thing, we can conduct a CBL2 on that. So
Yes.
am I correct in this?
Yeah, that would be correct as far as we are talking about preclinical students.
All right.
Yeah, that may not be exactly true for clinical students, because clinical students, they have already been through preclinical years. They have a lot of theoretical knowledge. So in many cases of CBL in clinical years, there may not be really a formal CBL1.
Yeah.
Yeah, so
Okay.
like Madam was saying previously, that we can actually skip CBL1, knowing that they have already that information. So, but you are absolutely right that the main focus is CBL2 and C, the application.
Application. All right. Yeah. Thank you very much.
Thank you.
Prof. Imdad here again.
Yeah.
Just one thing. For
Yeah.
CBL2, there are certain learning outcomes or learning objectives are there. When the students come to know about the learning objectives, once they come in for the second session or before the second session?
So in this case, we can tell them even before that. Because, for example, in my case, we can say that but you are right, there would be a limitation. We can say that we are going, the learning outcome we can give to the student is for example, the hemodynamics in different situations where are in different cardiac anomalies. So because the specific learning outcome would be given only there and then, but general learning outcome can be given. It means that they should know that they are going to discuss cases related to CVS before they come in.
Yes.
And again, it is different than PBL, because in PBL they come totally blank.
So the problem is the Prof. If we provide them the learning outcomes earlier, so they will be prepared already. So the information searching in the CBL2 won't be there.
No, in this case, they would know that in the coming session, we are going to apply the knowledge of hemodynamics in different pathological conditions. General thing, not a specific thing. It's that they, at least they know that they are going to talk CVS. At least they know that they are going to talk about different congenital anomalies, not very specific. Very specific like VSD or Eisenmenger, it would be only introduced during the session.
Okay, Prof. Okay, thank you so much, Prof.
Thanks.
Thank you.
Yeah, any other comments, questions? If none, thank you very much, everybody. Hope we would be meeting soon in near future.
Thank you very much. Thank you for your great effort, Prof.
Thank you. Thank you, everybody.
Thank you very much. It was very interesting.
Thank you very much. Jazakallah. Allah Hafiz.
Allah Hafiz.
Thank you very much. Thank you very much, sir.
Thanks.
Allah Hafiz.
Allah Hafiz.
Thank you. Jazakallah, sir.